Starting off with our histology, this is the microscopic anatomy of the heart and blood vessels. This is showing an example of cardiac muscle cells. Then we can see some of those cellular components like our gap junctions and desmosomes. So what are the key components of cardiac muscle histology? Remember, this muscle, like skeletal muscle, is striated, meaning it has these stripes. And these striations are due to myofibrils that contain actin and myosin filaments. And these actin and myosin filaments can pull on each other and essentially slide during muscle contraction. They are arranged in a lattice work arrangement. So we say that the cells are both branching. We can see these branch points here off of one cell, right? And they're branching in series and in parallel. So they're parallel to one another, and then they're in series next door to each other. In between these two cells, they have really a unique structure, and the structure is called an intercalated disc. It's circled here. These are cell membranes that separate the individual cardiac muscle cells, but they're unique in that they contain a high amount of gap junctions, which allow for rapid cell-to-cell movement of ions and small molecules, and they also contain desmosomes that prevent pulling or tearing of these cells apart when these cells contract. The important organelles inside cardiac muscle cells, besides our myofibrils, include a lot of mitochondria, much more than skeletal or smooth muscle, because this is really a high energy tissue. And there's T-tubules and the sarcoplasmic reticulum, which help with calcium cycling, allowing calcium to get into the cell, bind with troponin, and then be restored back into the sarcoplasmic reticulum when not needed. Some other histological components would be the layers of the heart wall. And you can remember the layers of the heart wall by thinking at EME, which is epicardium, myocardium, or endocardium, from outside to inside. So if we can even zoom in on this picture here and you can look at the layers. If we're starting outside, we have our epicardium here, this kind of thin layer on top. This is also the visceral layer or the organ contacting layer of the serous pericardium, and we would consider this the outermost layer of the heart. The myocardium is kind of this thick muscular layer. This is the circular and spiral bundles of cardiac muscle, what we just looked at histologically. This is also the thickest layer. And if we're looking at the different areas of the heart, the left ventricular myocardium is going to be the thickest overall because we have to, that part of the heart has to pump really aggressively to overcome systemic vascular resistance. And then the innermost layer, this tiny little stripe here, is our endocardium. And that's just simple squamous epithelium, and it's continuous with our blood vessel endothelium. So really it is going to be relatively the same type of tissue. And this lines all of our heart chambers, and it also covers the cardiac skeleton of the valves, the heart valves. So looking at then this other kind of component that we mentioned, one side of it, the visceral layer, are our pericardium. The pericardium is a sac. It's a double-walled sac, and it surrounds the heart, and it also surrounds our great vessels. There are two kind of layers, a superficial and a deep layer. The superficial layer is called the superficial fibrous pericardium. This is connective tissue. It is going to blend with our central tendon of the diaphragm, and its job is to protect the heart and anchor the heart. It also prevents overfilling because there's only a certain amount of stretch or give that it has. And then there's an inner layer, this deep layer of our serous pericardium. And this deeper two layer has a parietal and a visceral layer. The parietal layer lines the internal surface of the fibrous pericardium. So we can think of like the fibrous pericardium here. Then we have the serous pericardium here. Then we have a space. That's the pericardial cavity, which is filled with fluid, and that reduces friction. And then we have the visceral pericardium or the epicardium, right? The outermost layer of the heart wall. And that adheres to the external surface of the heart. So this is kind of the makeup of the pericardium as a whole. Now, the pericardium does receive blood. It gets blood from the pericardiacophrenic artery. Try to, you could say pericardiac cophrenic artery or pericardiac cophrenic artery if we try to say it all together fast. This branches off of our internal thoracic artery. There's also musculophrenic, bronchial, esophageal, superior phrenic arteries as well that provide some blood supply, but this is the main one. So really, when you're learning blood vessels, know the main vessel that supplies whatever structure you're trying to memorize, and then ideally know like kind of where it branched off of. The coronary arteries will only supply the visceral layer of the serous pericardium. So they're only supplying this layer here, this visceral layer here. So the other parts of the pericardium have to be supplied by the pericardiocophrenic artery. Drainage-wise, we have similarly named pericardiacophrenic veins, also brachiocephalic internal thoracic veins. That's what they drain into. And then nerve supply, it's going to be the phrenic nerves, which come off of C3 through 5 from those spinal nerves. Also sympathetic trunks, vasomotor, and the vagus nerve from our parasympathetic nervous system. Clinically, we can connect this to a pathology, pericarditis, or inflammation of the pericardium that can cause a physical exam sign or sound called a friction rub due to inflammation. Also, cardiac tamponade, another pathology. This is when fluid gets into the pericardial cavity or increases in the pericardial cavity and compresses the heart. So the heart is unable to contract effectively. These are showing some of these different branch points. We can see this is our heart here. This is showing our superior vena cava, our aortic arch here, our pulmonary trunk here, just to kind of give us some context. This is the vagus nerve coming down. And let me see if I can, well, I'll keep this on. This is the vagus nerve coming down. We have the internal thoracic artery. We have the phrenic nerve coming down here. We have our blood vessel, the pericardiac phrenic artery. This is the one that's providing the majority of blood supply to the pericardium. Then we have the drainer, the pericardiocophrenic vein or pericardiocophrenic vein. Fibrous pericardium here, and then some branches of these other arteries. This is also showing how it connects to the diaphragm. So it's a decent picture. This is just showing different layers of the heart, so you can kind of get an idea of what this looks like. And again, just the layers of the heart showing pericardial cavity and its relationship to like the pleural cavity as a whole. We'll stop here. When we come back, we'll look at blood vessel structure and talk about the 3-2 next.